Hello there. Please come in, make yourself comfortable. It's good to see you. My name is Dr. Alistair Evans. Now, I've hung up my white coat, officially speaking, after many decades spent listening to hearts, mending bones, and perhaps most importantly, listening to people. But the desire to share to help navigate this journey we call life, especially as we reach our later chapters, well, that doesn't just retire. It grows, I think. Like a well-tended garden, the wisdom deepens with the seasons. I find myself thinking often about my patients, friends, and indeed, my own journey into these golden years. There's a certain beauty to this stage, isn't there? A richness earned through experience. But it also brings changes, shifts in our bodies that sometimes whisper, and sometimes call out a bit more loudly, asking for our attention. Today, I wanted to talk with you, heart to heart, not just as a doctor, but as someone walking a similar path. We're going to discuss something important, listening to our bodies after the age of 70. Our bodies have carried us through so much, through triumphs and trials, through decades of work, family, laughter, and tears. They are remarkable, truly. But as the years accumulate like rings on a venerable old tree, our bodies communicate differently. Sometimes they send signals that things aren't quite right. Signals it's crucial we don't dismiss simply as getting older. Because often these signs are invitations. Invitations to seek help, to make adjustments, to ensure we continue living with health, dignity, and joy. So let's explore 5 common yet often overlooked signs that your body might be asking for a little extra help. Think of this not as a list of worries, but as a guide to understanding, a way to stay proactive and engaged with your own well-being. The first sign I want to touch upon is something that can creep up subtly: unexplained weight loss. Now, I don't mean the 5 pounds you worked hard to lose through healthy eating and exercise. I'm talking about noticing your clothes fitting much looser, perhaps your belt needs tightening by a notch or two you didn't aim for, or maybe friends start commenting that you look thinner, and you haven't intentionally changed a thing. It might start slowly. That favorite pair of trousers feels baggy around the waist. The comfortable old sweater hangs a bit more loosely than it used to. Sometimes it's accompanied by a loss of appetite, where food just doesn't hold the same appeal, or do you feel full after only a few bites? It's easy to shrug this off. We might think, well, maybe my metabolism has changed, or I suppose I'm just not as hungry as I used to be. But significant weight loss without trying, say losing more than 5% of your body weight over 6 to 12 months, warrants attention. Imagine losing 10 pounds if you weigh 200, without dieting. That's the kind of change we're talking about. Why is this important? Because our weight is often a reflection of our overall health. Unexplained weight loss can sometimes be an early indicator of an underlying issue. It could be related to dental problems making chewing difficult, medication side effects impacting taste or appetite, thyroid imbalances, digestive system issues that prevent proper nutrient absorption, or sometimes more serious conditions like infections or even cancer. It can also be linked to depression or loneliness, which can significantly dampen one's desire to eat. The key here is the word unexplained. Your body might be telling you that it's not getting the fuel it needs, or that something internally is disrupting its balance. What should you do? Don't ignore it. Keep a little note of your weight, perhaps check it weekly for a few weeks. Track your appetite and what you eat. And most importantly, make an appointment to see your doctor. They can review your medications, ask detailed questions about your symptoms, perform necessary tests, and help uncover the reason behind the change. It might be something easily addressed, like adjusting a medication or finding nutritional supplements that help. Sometimes simply talking about challenges with eating or appetite can open doors to solutions, like meals delivered to your home or social dining programs. Nourishing our bodies is fundamental at every age, and noticing when that balance shifts is the first step toward maintaining strength and vitality. Moving from physical nourishment to physical energy, let's talk about persistent fatigue. Oh, tiredness. It's a familiar companion as we age, isn't it? A full day of gardening, playing with grandchildren, or even just running errands can leave us feeling ready for a good rest. That's normal. That's the healthy fatigue that sleep repairs. But I'm referring to something different. A deeper, more persistent exhaustion that doesn't seem to lift, even after a full night's sleep or a restful day. It's the kind of fatigue that makes climbing the stairs feel like scaling a mountain, that drains the joy from hobbies you once loved, that leaves you feeling perpetually foggy or heavy, as if you're wading through treacle just to get through the day. You might find yourself needing naps more frequently, but they don't truly refresh you. Or perhaps you lack the energy even to socialize, preferring to stay home when you used to enjoy getting out. Again, it's tempting to attribute this solely to age. I'm just slowing down, you might think. And yes, our energy levels naturally modulate over time. But profound, ongoing fatigue is a signal flare from your body. It's saying something is depleting my reserves. What could it be? Well, the possibilities are varied. It could stem from underlying medical conditions such as anemia, where your blood isn't carrying enough oxygen, thyroid problems, affecting your metabolism, heart conditions, where the heart struggles to pump efficiently, sleep apnea disrupting restorative sleep, chronic infections, or even side effects from certain medications. Mental health also plays a huge role. Depression and anxiety can manifest as overwhelming physical fatigue. The constant hum of worry or the heavy weight of sadness can be incredibly draining. So if this deep weariness resonates with you, please don't simply accept it as your new normal. Start by keeping a simple diary for a week or two. Note your sleep patterns, your energy levels throughout the day, what activities seem to drain you the most. Then take this information to your doctor. Be specific. Instead of just saying, "I'm tired," describe how it impacts your daily life. I used to walk for 30 minutes. Now I can barely manage 10 without needing to sit down. Or I fall asleep reading in the middle of the day, even after sleeping 8 hours. Your doctor can conduct tests to rule out physical causes like blood counts, thyroid function, and heart checks. They can also discuss your mood and sleep quality. Sometimes adjustments in lifestyle like gentle, regular exercise, even a short walk can paradoxically boost energy, or dietary changes can make a difference. Addressing underlying health issues or managing mental health challenges can restore vitality you thought was lost. Remember, while life slows down, feeling constantly drained isn't an inevitable part of aging. Your energy is precious. Listen when your body says it's running low. Now let's gently turn to a topic that can feel sensitive, even a little frightening. Changes in memory or thinking. We all have moments of forgetfulness. Where did I put my keys? What was the name of that actor? Walking into a room and forgetting why you went there. These occasional slips are perfectly normal, often just a sign of a busy mind or temporary distraction happening at any age. But the changes I want to highlight are more persistent or disruptive. Perhaps you or your loved ones notice you're repeatedly asking the same questions, getting lost in familiar places, having trouble following conversations or instructions, struggling with tasks that used to be simple like managing finances or cooking a familiar recipe. Maybe finding the right words becomes a frequent challenge, or your judgment seems impaired in ways it wasn't before. These aren't just momentary lapses. They represent a shift in cognitive function. It might feel unsettling, even embarrassing, to acknowledge these changes, either in ourselves or in someone we care about. There's often a fear associated with memory loss, a worry about what it might mean for the future, for independence, for identity. But ignoring these signs doesn't make them go away. It only delays potential help and understanding. Why might these changes occur? It's not always dementia, though that is one possibility that needs careful evaluation. Cognitive changes can be caused by many other factors, some quite treatable. Vitamin deficiencies, particularly B12, can impact brain function. Thyroid problems can cause mental fogginess. Infections, like a urinary tract infection, can sometimes cause sudden confusion, especially in older adults. Medication side effects or interactions are common culprits. Poorly managed chronic conditions like diabetes or high blood pressure can affect blood flow to the brain. Even dehydration, depression, or hearing loss can impact cognitive abilities. The crucial step is seeking a thorough medical evaluation. Your doctor can review your health history, medications conduct cognitive screening tests and order blood work or imaging if necessary. They can help differentiate between normal age-related changes and something requiring further investigation. Catching treatable causes early can sometimes reverse the cognitive changes. And even if the cause is something like early Alzheimer's or another dementia, an early diagnosis allows for planning, accessing support services, and exploring treatments that might help manage symptoms and maintain quality of life for longer. Keeping the mind active through puzzles, reading, learning new things, and staying socially connected are also vital. Please approach this topic with courage and compassion, whether for yourself or a loved one. Acknowledging changes in thinking isn't a sign of weakness. It's a proactive step towards understanding and support, preserving dignity and connection. Let's shift our focus slightly downward to our feet, our balance, and the way we move through the world. The fourth sign your body might be asking for help involves difficulty with balance or experiencing increased falls. Perhaps you've noticed a subtle unsteadiness when you stand up too quickly. Maybe you find yourself reaching for furniture or walls more often to steady yourself while walking. Or perhaps you, or someone you know, has actually experienced a fall, or several near falls. Dizziness, lightheadedness, or a feeling that the room is spinning can also be part of this picture. Falls are not, I repeat, not a normal part of aging. While the risk does increase as we get older, falls often signal an underlying problem that needs addressing. And the consequences can be serious, leading to injuries like hip fractures, head trauma, and a fear of falling that ironically can lead to decreased activity, further weakness, and social isolation. It becomes a vicious cycle. So what might be causing this newfound unsteadiness? It could be related to changes in vision. Cataracts, glaucoma, or macular degeneration can affect depth perception and spatial awareness. Hearing loss, particularly problems with the inner ear, which helps regulate balance, can be a major factor. Muscle weakness, especially in the legs and core, makes it harder to maintain stability and recover from a stumble. Arthritis can cause joint pain and stiffness, altering gait. Certain medications or combinations of medications are notorious for causing dizziness or drowsiness that affects balance. Blood pressure pills, sedatives, antidepressants, even some over-the-counter drugs. Neurological conditions, low blood pressure, orthostatic hypotension, that head rush when you stand up, dehydration, and even low blood sugar can contribute. The good news is that many of these causes are identifiable and manageable. If you're experiencing balance issues or have fallen, it's vital to tell your doctor. Be prepared to discuss when the dizziness or unsteadiness occurs, what it feels like, and any medications you're taking, including supplements and over-the-counter ones. Your doctor can perform balance tests, check your blood pressure lying and standing, review your medications, and assess your vision and hearing. They might recommend physical therapy to improve strength, flexibility, and balance through specific exercises. Simple home safety modifications can make a huge difference. Removing trip hazards like throw rugs, ensuring good lighting, installing grab bars in the bathroom, and wearing supportive, non-slip footwear. Using a cane or walker, if recommended, isn't a sign of defeat. It's a tool for maintaining independence and safety. Staying active within your safe limits helps maintain muscle tone and coordination. Protecting yourself from falls is crucial for preserving mobility and confidence as you age. Listen to your body's signals about balance. They are important messages about your safety and well-being. Finally, let's talk about something deeply intertwined with our physical health, yet often kept hidden: significant changes in mood or withdrawing from life. I'm not talking about having an occasional bad day or feeling a bit blue now and then. We all experience sadness, grief, and worry. These are normal human emotions, especially when facing losses or health challenges common in later life. The sign I'm referring to is a more persistent shift. Perhaps feeling down, hopeless, or anxious most days for weeks on end. Losing interest or pleasure in activities you once enjoyed. Maybe gardening feels like a chore, visiting friends seems overwhelming, or your favorite hobbies gather dust. Maybe you notice increased irritability, restlessness, or difficulty concentrating. Changes in sleep patterns, sleeping too much or too little, And changes in appetite we discussed earlier can also be linked to mood. Another key aspect is social withdrawal, consistently turning down invitations, avoiding phone calls, or isolating yourself from family and friends. It's easy for both the individual experiencing this and those around them to dismiss it. Oh, he's just getting grumpy in his old age, or she's bound to be sad after losing her spouse, or I just don't have the energy for people anymore. While life events certainly impact mood, persistent low mood, anxiety, or withdrawal that interferes with daily life is not an inevitable consequence of aging. It could be depression and anxiety disorder, or a reaction to overwhelming stress, chronic pain, or isolation. These are real medical conditions, just like diabetes or heart disease, and they deserve attention and treatment. Untreated depression or anxiety significantly impacts quality of life, can worsen physical health problems, impair cognitive function, and even increase mortality risk. Why does this happen? Sometimes it's related to biochemical changes in the brain. Other times it's triggered by life circumstances, coping with chronic illness or disability, grieving losses, feeling isolated or lonely, financial worries, or even medication side effects. The important thing is recognizing that help is available. If these feelings resonate with you, or if you notice these changes in a loved one, please reach out. Talk to someone you trust, a family member, a friend, a spiritual advisor. And crucially, talk to your doctor. They can screen for depression and anxiety, review potential contributing factors like medications or physical health issues, and discuss treatment options. Therapy, counseling, support groups, medication, or a combination of these can be incredibly effective. Sometimes just addressing underlying issues like chronic pain or finding ways to increase social connection can lift one's spirits immensely. Staying connected to others, engaging in meaningful activities, even gentle exercise, can protect and boost mental well-being. Your emotional health is just as important as your physical health. Feeling joy, connection, and purpose are vital parts of a fulfilling later life. Don't suffer in silence. Your feelings matter, and reaching out is a sign of strength, not weakness. So there we have them. 5 important signals: unexplained weight loss, persistent fatigue, significant changes in memory or thinking, increased problems with balance or falls, and persistent changes in mood or social withdrawal. These aren't meant to cause alarm, but rather to foster awareness. Think of your body like a lifelong friend. It communicates with you constantly. As we age, its language might change, become more subtle, or sometimes more insistent. Our task, our privilege really is to keep listening attentively, with kindness and curiosity, not dismissal or fear. Dismissing these signs as simply part of getting old can mean missing opportunities to address treatable conditions, to prevent complications, to maintain independence, and to enhance the quality of these precious later years. Your health journey is unique, and you are the foremost expert on your own body. Trust your instincts. If something feels off, if you notice a persistent change, please speak up. Talk to your family, talk to your friends, and most importantly, talk to your doctor or healthcare provider. Prepare for your appointments. Maybe jot down your concerns, when they start and how they affect you. Be your own best advocate. Embracing these years means embracing proactive care, seeking help when needed, and treating ourselves with the compassion and respect we deserve. There is so much life, wisdom, and experience to be shared and enjoyed after 70. By paying attention to these signals, we empower ourselves to navigate the changes with grace, to seek the support available, and to continue living as fully and vibrantly as possible. Thank you for spending this time with me. Take good care of yourselves and listen closely. Your body has important things to tell you. Be well.